All right, I'd like to call the Human Services Committee to order today, September 7th. Roll call, please.
Commissioner Brown,
Yes, here.
Commissioner Sear, excused. Commissioner Hughes, Commissioner Larry,
Here.
Commissioner Nash,
Here.
Commissioner Pago,
I'm excused.
Chairman Skolnick,
Here.
Commissioner Wilkins, Chair Hobie Wright.
Like to entertain a motion to approve the minutes of August 3rd.
So moved.
Support.
It's been moved and seconded. Is there any questions? In favor?
Aye.
Aye. That passed. Public comment on an agenda item.
There's no one online.
Okay. None? Okay, yeah, because I couldn't get it up. Okay, moving on to items for consideration. First item is HS 21/09-22 from Public Health Kathy Moore to authorize Public Health to request bids for drinking water laboratory analysis for the period of October 2021 through September 2022 with the option for two one-year renewals with no change in general fund appropriation.
So moved.
Support.
It's been moved and seconded to approve number 22. Are there any questions, comments, or concerns? Seeing none, we'll move on to a vote. Roll call, please.
Commissioner Hughes,
Yes.
Commissioner Larry,
Yes.
Commissioner Nash,
Yes.
excused. Chairman Skolnick,
Yes.
Commissioner Wilkins, Commissioner Brown,
Yes.
Commissioner Sears, excused. Commissioner Hobie Wright.
Yes. Okay. So that passed unanimously. The next one is HS 21/09-23. Public Health Kathy Moore to approve entering into a contract agreement with Senior Resources for Senior Millage Grants Administration Services effective October 1, 2021 through September 30th, 2023.
So moved.
Support.
It's been moved and seconded. Are there any questions, comments, or concerns? Seeing none, roll call, please.
Commissioner Larry,
Yes.
Commissioner Nash,
Yes.
Chairman Skolnick,
Yes.
Commissioner Wilkins,
Yes.
Commissioner Brown,
Yes.
Commissioner Hughes.
No.
Chair Hobie Wright.
Yes.
6 and 1.
Okay, the next one, that's passed. The next one is HS 21/09-24, a resolution to approve the resolution to declare September 21 as National Recovery Month in Muskegon County, and that a copy of this resolution be sent to Governor Whitmer, Bumstead, Representative Sabo, Representative Van Workum, Michigan Senate, House of Representatives, and the Michigan Association of Counties, and to the clerk of each county. And a copy of this is there a motion to approve this
So
resolution?
moved.
Support.
It's been moved and seconded. Is there any questions, comments, or concerns?
I do.
Yes.
It would have been nice if they had bothered to tell us what the figures were and how much recovery there was. We've never seen any results or anything from Health West on this. I mean, they never tell us what's going on, who's got what, how they're, it's hard for me to support a resolution for something I've not seen any reports on as successful.
Okay, are there any others, any other comments or concerns?
Madam Chair, I have a comment. So we just had a resolution that was contested widely about the value of it and what is the value of these resolutions? If you didn't think the other one had value, declaring freedom for residents to make their own choices. Now we're declaring that Muskegon County is got a mental health issue we're trying to recover from, and this is supposed to give us a bright, shiny face and make us look good. I don't understand why Muskegon County would declare something like this, but wouldn't declare medical freedom from our constituents. This is seems.
I don't think it's peculiar to Muskegon County. There are mental health issues everywhere. COVID hasn't helped that situation at all, so I know maybe Mr. Nash would introduce this, would like to answer that.
Actually, this is really has to do with recovery. This is not about COVID. It's about recovery, which has been a long-term issue in this country since God knows when. And people are always in recovery when it comes to mental health, when it comes to substance abuse. And this is an act of our county trying to bring more attention to this month, September, as National Recovery Month. It's been established as a National Recovery Month, and we're just following suit and doing that. It's really not doing anything in particular except saying
And it's
we
not a
also,
new
as the
thing.
Board of Commissioners, acknowledge this month and support it. So
This is not a new,
it's not a, no,
No,
it's not
it's been every year.
It's new. It's just new for us to put a resolution together and support it. That's it.
Mr. Nash,
Yes,
is this a national,
yes,
it's a national?
yes.
So you're not saying that we're succeeding, you're just saying we're
No,
recognizing there's
we're
a
just
problem?
recognizing the month and we're recognizing that we support those that are constantly battling with these different illnesses. And that's generally what it is. It's not a political point of any whatsoever, but I know there's tons of people in this community. I work with these folks every day. You know, I also know family, friends, and the ones that struggle with these different things. You'd be surprised how many people struggle with mental illness. And it doesn't mean that people are, you know, need a padded room. It's just that some people, you know, have anxiety. Matter of fact, I just traveled, but talking with the extended family member, and you know, they said that they just met with their doctor a couple weeks, and they said that they probably had anxiety more than when they got diagnosed. They probably started before that. Who knows? But again, a new person being introduced to some mental illness that they didn't even realize that they had. And so, like I said, it doesn't always have to mean that someone has severe mental illness, but recovery for mental illness is a lifetime thing, and it's also for those with substance abuse. 'Cause once a substance abuser, you can always revert back to that at any day. So we're just trying to help support people in what is already established as a National Recovery Month. And we're just acknowledging it here in Muskegon County.
are there any other?
I have another question.
Yes,
Charles,
Commissioner.
because this is, this is kind of what you do. You don't think that this is gonna make people feel like now they're promoting, now they're putting a big thing out there that says I have mental illness and,
No,
You
it's
don't
not,
think
it's not to point anyone out in particular. What this does is it gives Health West more ability to, you know, inform, bring awareness to this, and also enlighten folks around the community about the community supports that are out there. Not only does, you have to remember, Health West is not the central location where all this takes place. That's why they contract out to so many different agencies. So we have tons of agencies here, there, and everywhere that deal with people in different areas depending on what their need is. So it's a broad umbrella. It's a huge umbrella. And because I even asked about the data, and you can get some sort of data, but also you have to understand too, these organizations are private entities too, and it's hard to just grab that data from them as Health West. But I think most of that information goes to the state because of the Medicare costs
Yeah.
and the coverage and things of that sort. But other than that, you know, it's hard to just
I just felt
Pull
like,
that.
I think it's just it's meant to be an educational tool, an opportunity to,
I felt like it would be kind of
inform
like playing a
people.
flag that said, anybody who comes in here has a mental illness. And I would think it would be hurt people's feelings, I guess.
except probably every other county's doing it too. Have we fully discussed this? Any other further questions or concerns? Roll call, please.
Commissioner Nash,
yes.
Chairman Skolnick,
Yes.
Commissioner Wilkins, Commissioner Brown,
No.
Commissioner Hughes,
No,
Commissioner Laring,
So
Commissioner Hobie Wright,
Yes.
4 yes, 3 no.
Okay, so that passed. Is there any unfinished business? Any new business? Any public comment? No public comment. Final board comments.
It's been a long day.
Yes, it is. Okay, is there a motion to adjourn?
Support.
Thank you.